Disseminated intravascular coagulation is a disorder where there is a formation of the thrombi, the thrombin thrombi, or there is the formation of the microthrombi from the fibrin. Basically, at first there is the formation of the thrombi, and you can say that there is the increase in the coagulation process at first. Later on, what happens in the body, there is a deficiency of the platelets and the coagulation factor that leads to the fibrinolysis and increased bleeding. So you can say that this is a kind of the disorder in which first there is the formation of the thrombi in the blood vessels, means that the blood vessels are going to be blocked. There is increase in the coagulation process, and later on there is the fibrinolysis because of the deficiency of the platelets and deficiency of the other coagulation factor. There will be these thrombi that are formed, they will be simply dissolved. So at first, the thrombi can be seen in the patient who are suffering from disseminated intravascular coagulation, and later on they disappear, and other factors like thrombocytopenia and some other factor that we will discuss are important in the diagnosis of such kind of the patient. Now, if we discuss about the pathophysiology of the disseminated intravascular coagulation, there can be various external and internal factors that can lead to the cause of this disease. Like here, let's see, first of all, there can be any tissue injury. There can be any tissue injury because of any disease, any kind of inflammation, or any kind of, you can say maybe a trauma can be a reason of any tissue injury that is leading to the disseminated intravascular coagulation. Again, with the tissue injury, there can be the endothelial cell injury that can occur because of any kind of the disease or the trauma. Infection as well. Infection can also be a reason of such kind of the injury. So the thing is, whenever there is the tissue injury or endothelial cell injury, what will happen that there will be the tissue factor expression, the factor 12 activation, and platelet activation. So this is a summary of basically the coagulation process is being activated, platelets are being activated, and here after the activation of the platelets, there will be the formation of the thrombin. So thrombin will be formed, and there will be the intravascular coagulation that in which there will be the consumption of clotting factors 5, 8, fibrinogen, and platelets. All of these are involved as in the formation of the blood clot. There will be such coagulation process, and that will stop the now whenever these factors are activated, they will stop the bleeding. A blood clot will be formed. But here, because of the excessive platelet activation, there is the formation of the thrombin, and there is the intravascular coagulation. Whenever after the formation of the thrombin, there is the intravascular coagulation. Because of that reason, these clotting factors that are involved in the clotting process, they are consumed. Now, after their consumption, they are deficient in the body. So that may lead to the bleeding. There will be also the formation of the fibrin microthrombi, and that may lead to the microvascular occlusion. Small arteries or small venues, they can be occluded by these microthrombi that is formed by the fibrin. That can lead to ischemic tissue injury, microangiopathic hemolytic anemia as well. Moreover, after the formation of these fibrin microthrombi, there is the fibrinolysis that can lead to the bleeding as well. And as there is a deficiency of the coagulation factor, so that will also cause excessive bleeding in case of the injury. There will be the fibrinogen and fibrin split products that will be produced, and they inhibit platelet aggregation, fibrin polymerization, and thrombin. Now, you can see that first, tissue injury, the patient is affected. He is disease. Disease is present in his genes. So what will happen is that tissue factor will express, factor 12 will be activated, platelets will be activated. That will lead to the formation of the thrombin. And thrombin will lead to the intravascular coagulation. All the coagulation factor will be consumed, leading to the bleeding, and fibrin microthrombi are formed that may lead to the ischemia in small vessels, And also there will be the fibrinolysis caused by the plasmin, and there will be the different products will be produced as a result of the fibrinolysis that will ultimately hinder the process of the platelet aggregation and the fibrin polymerization, and also the activation of the thrombin. So all of these things are going collectively going to affect the process of the coagulation and will cause bleeding in such kind of the patient. Now, if we talk about the pathology of such kind of the patient, so as I told you that in such patient, at first there is a formation of the microthrombi, and after that, that microthrombi dissolve. Now, here in this diagram, basically you can see this deep purple color is indicating the fibrin. So here, these are the site where this fibrin is accumulated. Basically, this is a diagram of the glomerulus. So in this glomeruli, these are the site where microthrombi are formed by the accumulation of the fibrin. Now here, when the microthrombi appear in such cases, you can diagnose this disease easily. But in case of the patient where these thrombi has been dissolved and there is the bleeding, then you may need to focus on other things, like the patient, the ischemia can be there, there can be the thrombocytopenia, and there can be some other clinical features that can be seen in such patient that will help you to diagnose the patient, that the patient is suffering from the disseminated intravascular coagulation. Like discussing about those clinical features, the patient may suffer from the microvascular thrombosis. Bleeding tendency of the patient will be increased. Patient may suffer from seizures and coma, like when the blood vessels that are involving the brain are affected. Similarly, the patient may suffer the mild azotemia to fulminant acute renal failure in cases when thrombi is present in the kidney, in the blood vessels of the kidney. Then there can be the acute respiratory distress syndrome when the respiratory system is involved. There can be the acute ulcers that can bleed severely, or there can be the bleeding diathesis that can lead to the cerebral hemorrhage, ecchymosis, and hematuria. These are all the symptoms or the clinical features that can be presented by the patient who is suffering from disseminated intravascular coagulation.